Good. So welcome everybody. Thank you very much for Vivian for having us here and giving us the opportunity to talk to you about what we do as chiropractors. I have Max here as well, as we just introduced. So a little bit about me. I set up the Chiropractic Centre in Billericay initially in 2014. I'd been practicing 6 years before that in Brentwood. And I have a whole family of chiropractors. I'm a third generation chiropractor, and my family goes back to 1921. I think my grandfather first became a chiropractor in New Zealand. He's one of about 6 in the country. So I'm not that old, but yeah. So I'm just very passionate. I love what I do. I think Vivian can attest to that. For me, chiropractic is not just chiropractic. It's about healthcare. It's about people's entire health. And it's also beyond. Actually, let's put a show of hands. Who thinks they know what a chiropractor does?
No, we don't want to put up
well, shout out some things. What do you think you hear when you hear the word chiropractor? What do they do? Clicks, crunch, popping. Yeah. And believe it or not, most healthcare practitioners in the NHS that we deal with probably think the same thing. And I like to think what we do is more. I'd like to think what I do is more than that. My goal is following people's health all the way through. So I have people that have maybe not got the benefits that they wanted with me. It's rare, but it does happen. But I follow those people and say, well, let's see what else you're doing. Let's write a letter back to the GP and update him, you know. And I don't charge people for that. It's very important because I want to care about people like they're my own brother, sister, mother, father. And I think that's the difference between being good at what you do in any profession. We have teachers here, going above and beyond. It makes you feel good too, right? So that's me. I'm going to pass you to Max for a second. He's going to introduce himself.
So hi everyone, my name is Max. I'm a chiropractor at the Chiropractic Centre in Billericay and Brentwood. I studied at Teesside University, which is quite far from here, but loved every second of it. Why I became a chiropractor was, since I was young, I've always wanted to go into healthcare. I've always wanted to help people. I had quite a different beginning into healthcare. First wanted to be a brain surgeon, said, scrap that, don't want to do that, don't want to cut into people, not my thing. But ultimately, through my search into a profession in healthcare that I wanted to find was chiropractic. I found it isn't just symptom relief, it's also function. It's not just getting a cure for a symptom, getting you out of pain, but it's also looking at the whole body. How's everything functioning inside you? How we can help you reach your goals in health, and how we can get you better in general, in everything, in all aspects of health. That's why I became a chiropractor, and that's what my goal is and my motivations of why I want to help as many people as I can. So thank you very much.
What it isn't. So chiropractic to me is not clicking and popping, believe it or not. Somebody comes in with a bad back, they say, I've come here with my bad back, that's great. But that's not what I'm going to do for you. But let's look a bit bigger. So if you imagine, we all know our Venn diagrams, right? Big circle. That is pain. So when people go to a chiropractor, they say, yeah, I've got this, I need you to help me with that. I'm like, well, do you want me to help you with the rest of your entire body and neurological complex? I mean, that piece of cake. But let's look at the rest. Why have you got the pain? You know, a big common thing I see a lot of people come in, they'll say, oh, I've got anemia. I'm taking the iron tablets. I say, okay, that makes sense. You've got anemia, you've got taking the iron tablets. Why have you got the anemia? I don't know, I'm just taking the iron tablets. Well, you want to know what's causing it. There's many different causes of anemia. Blood loss from, for example, a major car accident. That's pretty obvious, you can see what's going on. Menstrual bleeds, again, that can cause it. So children when they're 13, 14, going through the first period, they can start to have anemic symptoms. Then we know the cause. But also cancers can lead to anemia as well. Ulcers in the gut, bleeding into the stomach, etc. And some things that are more serious. So you do want to find out rather than just cover it up. And going back to this here, going to a chiropractor, just get your back clicked and put back in place, that's easy. You can go lots of places that will do that. But the principle, the underlying principle of chiropractic, which I like to get back to, is based, if I look back at my family history, is about maximizing the potential of your nerve system. So A little bit of anatomy lesson. We've got a spine. Here we go. So as we go through, what we're going to do, we're going to talk about what chiropractic is and what it is not. We're also going to go through, Max is going to talk a little bit about the organ systems and how that connects in. And then we're going to talk about some postures, some takeaway stuff that we can apply. Okay? And as teachers, posture is very important because we're leaning, bending, twisting. We'll go through some of that. But let's have a look at the biomechanics of the spine. So should be 3 curves, one in the neck, one in the mid-back, and one in the low back. And that's like a giant shock absorber. So if you were like to walk off a curb, if you had a straight leg, it would kind of jar, right? But we bend our knees, and it's just very subtle. We've got cartilage in our knees as well, just as we have cartilage in between the bones of the spine. These are called discs. And that is what we would call maybe a disc prolapse, disc bulge, or in severe cases where it herniates out, disc herniation, sequestration, there's many different names. And that can press on the nerve and then give people pins and needles and tingling into their legs. Who's come across somebody that may have had that? Anyone? Yeah? Lots of people may have had people. And you'll find that they sit down, it really hurts, because when you go like that, there's a jelly inside of each of these discs. And if the one is kind of leaking, it squirts it, and it typically goes backwards onto the nerve, which then goes down the leg. And that's why they're getting it when they're sitting down. They've got to, I've got to get up and move around. Yeah? More likely a disc. Next, so we're talking about these curves from the front. Now this is particularly important with teachers, and we've got a talk with the kids coming up later. So I want really to drum home this message with teachers. They need to see this one as well. From the front, how many curves have we got? From the front? None. 0. Sometimes we get this, and this is called a scoliosis. And this will affect predominantly children from the ages of 0 up to 16, 17. After that, they stop developing, like physically growing wise, and so it's pretty much set. Now, you imagine the spine is child's growing, growing, growing. It's like a tree growing. If the tree grows bent, and it's like, say, 17-year-old tree that's all grown bent, what do you think you have to do to bring it back up right straight? Yeah, so surgically cut and screw in rods, etc., to pull it back. Now, if you were looking at that lovely tree, who's a gardener here? Yeah, I love my garden. So you're seeing the tree and it's kind of growing, and you see it growing bent, and you want a nice pristine tree because you know that's going to look lovely in the garden. Do you leave it growing bent? What do you do?
Straighten it.
How? With guide ropes maybe? Yeah. But you'll put something in place to kind of bring it back up, and then you know it will grow up straight, and when it's growing up straight, it's not going to then all of a sudden go bent, right? And it's the same thing with our children. So very simplest thing to do is if you ever look at a child straight on, look at the shoulders. Is it like that? The hips, like that. Or if they're bending forward, say they're in P or something, they just bend forward to pick something up, and you're just behind them and glance, and their shoulder goes like that. Or the low back sticks out on one side. They have possibly a scoliosis. It could be muscular tension from overdeveloping, especially athletics. I had a chap once who was a canoeist. I think he canoed at high level, like for England, and he had massive overdevelopment on one side. He didn't have a curvature. It looked like it. But if you see that presenting, it is better to rule it out, because if the tree is growing bent and you think, not my problem, that child will grow bent. And it's one of the biggest listed things in the World Health Organization. I remember from years ago, there's 2 big things that will change a child's entire lifetime physically that you can change. Congenital hip dysplasia, clicky hips, which some of you may have heard as well. It's usually picked up at birth, and they put them in double nappies. So we check that with children that come in. But scoliosis as well. And if they have a scoliosis and it's bent like that, and they have pain, they may have that pain for the rest of their life. So, and a lot of children will have that, and they won't have pain. And that's the big thing. That's the difference between what chiropractic is. It's not looking at pain and clicking people. It's looking at biomechanic and function before they get the pain to make sure that they are in the best place in 20, 30, 40 years. Does it make sense? Yeah. So it's preventative, if you would like to say it otherwise. So chiropractic is also about looking at the nerve system, where these nerves come out, and if they pinch, you want to take the pressure off that. It's usually in the spine, because it's like a hose in the faucet. where the water's coming out at the start, right up the brain and through the neck through here. But these nerves can be pinched in forearms. We've got common extension, RSI typing, nerves being pinched in there, so we can loosen up that. And we have soft tissue therapists that work with us. So there's a team of 10 of us, and we may refer yourself off for that, so that will loosen that up. But prominently we look at the spine because that's where the nerves come out. So the simplest way of thinking of a chiropractor, when you say to somebody, oh, don't they click and pop you? Say, well, as I understand, they're a nerve doctor. Yeah, so we learn a lot of the same stuff that the neurologists learn. But we also have a bit of radiology as well. So I can take x-rays, which you need to be trained for. I can read MRIs of the spine. I sometimes refer people off for MRIs to the spine for that reason. And I'd like to think we also care that little bit more. But really it's about focusing on people getting better. So yeah, what it is and what it isn't. We've talked a little bit about the anatomy. I'm going to pass you over to Max, and he's going to talk a little bit about organs and something you may not know about how chiropractic and the nerve system can affect you.
So, as Grayson mentioned, where do the nerves go? Everywhere in the body. That means, does anyone know what this organ is? Heart, this, lungs, and my drawings are pretty bad, so liver, yes. So, as you can see, this is your thoracic spine, so the mid-back. All the nerves here go into your organs and abdomen. So all of this function is how your body would function, how your nerves or how your organs would function. So what we like to think about as well is if we can offload pressure of those nerves, these organs can function better. Now, a little disclaimer, what we're not saying is we can help all organs and all organ issues. If we do find one, we would refer you to a specialist, like a cardiologist, etc., for that issue. However, potentially what we can also have is a slight benefit of taking pressure off these nerves. Now, I personally haven't had any experience or any cases where this has happened, but I know Grayson, if Grayson would like to add into it as well, Grayson has had a few patients where they've seen quite a lot of benefit in their organ systems as well. So.
Yeah, thank you. So years and years ago when I was in practice, I remember learning this, and it was back like 2008-9, like a long time ago. And they had a patient that come into the clinic that I was working in. This woman had come over from America, and she'd said, look, I need to get adjusted because my T8 is out and I'm feeling a bit wheezy. Now, most people in this country, even chiropractors, might think, what are you talking about? T8, what? You got back pain, neck pain? What? But in the States, chiropractic's viewed slightly differently. And this is where it originated, all from the US. We talk about the organs, etc. And T4, actually not T, it was T4, T5, they kind of feed into the heart and into the lungs. And she had asthma. And she found that when she got adjusted, she felt she could breathe better. Now, I'm not saying chiropractic is curing people of asthma. You know, there's 5 different criteria for asthma. There's a mushroom that can cause it, exercise-induced asthma, there's lots of things. But if you think logically, if you have asthma and your lungs are not expanding, then you're not getting that movement through the rib joints, and they kind of seize up. And what happens if you don't move joints? The muscles tighten, seizes up, and then you try to move it, it's a bit painful. And if you unlock those ribs and getting it moving, it feels now like you can move and breathe better. Yeah, so it kind of, and so she got adjusted and she felt better from it, you know. But if I go out there and say, yep, chiropractic helps with asthma, no, this is the thing, chiropractic is not about curing anything. It's about making sure your body functions correctly. And simplistic, which actually I didn't say on the vertebrae, the spine, if you've got 2 vertebrae, so imagine all your vertebrae, okay, and you've got nerves coming out. If I can borrow your finger for a second, I'll get you to stand on that. Alex, don't worry, your time's coming. So here's a nerve coming out, and there's all these nerves coming out each side of our spine. And here's the bones, and if that joint moves slightly out of place, you feel a little bit in here, right? Not too bad. And so a lot of people ignore this. They're like, oh, I've got a little niggle, it's not too bad. And then maybe it corrects. The body's intelligent. You know, you don't work as, you move less in a certain position, it's aggravating it. But if you go back to that position in the office chair and you're sitting and you're hunched over, and you all of a sudden start to get it. And now it's starting to get a bit annoying. And then one day, a long day in the office, and you're like, oh, my back just went. I've got to go see the chiropractor. But you should see the chiropractor before, you see. And then we do that. That feel better than that?
Yes, of course.
And that's how simple it is. And that's very confusing to a lot of healthcare professionals because they're like, what is he doing? Can't be, that's magic hocus pocus. But it's physiological. You're taking pressure off a nerve and allowing it to function better. And that's it. So in this particular case with this person who'd come in and they're a bit wheezy, etc., we're literally just moving the joint. In this case, the rib dysfunction. Move the rib, pressure off the nerve. Joints can move better. Brilliant. If you had a nerve that was pinching around T4-5 and those nerves also go through where the heart is, and you've come in with low back pain, and we check the back and maybe there's a restriction there and we can move that, take the pressure off the nerve. But we found that little slight one that's just out of place, but you're not necessarily feeling it yet. Would you want us to take care of that as well? By the way, it's the same price. Yeah. Because chiropractors that look at the entire system should do that. They should look at the entire system. It's like, here's the brain going down. If you've got a low back issue and you've got a restriction here, anywhere from here down to the back, that's affecting the pipeline, right? It's going to your brain. You feel pain here because there's a pathway from here to your brain. So anything in between that's slightly irritating, even if you don't necessarily feel it yet, it's having an effect on that system. So you want to clear the entire system out and be like super highway, super fast. Has anyone seen chiropractors that work on athletes? No? Ever thought about that? So there's a great picture. I need to get it up. I keep saying get it up one of these days. You have to remind me. It's Usain Bolt before he won the 100, 200 meters gold. Does everyone remember way back then? Yeah. And he ran it, and I love it because I think it was the 200 or the 100. He was running over the line waving or something when he went past. It's just incredible. There's a picture about 10 minutes before he was getting adjusted by a chiropractor. Did he have pain? Probably not. But what we do know from studies is that if you take pressure off a nerve and it functions better, your speed and reaction is faster. You think quicker. I'm a kind of believer that, is there evidence for that? No, I can't say there is. But I was the, let's say, word is not stupid because I wouldn't say that, but it was the lowest in the class from academic point of view. When I was 13, 14, I was getting bullied a bit. And my dad said to me, you step up, you've got to change, you're going to a different school. I was going to high school. And he said, you've got a chance. If you want to do something different, you've got a chance, but come and get adjusted. And so I went to that school. Whether it was that prep talk, never really listened to my dad before, but that prep talk, or the fact that I actually went and saw him and I got adjusted, it got checked every day for 4 years, barring about 3 weeks, every day. Not like once or twice a week. Every day I went and saw him and he checked my neck and he adjusted me if it needed to be. And I topped the class twice, and I believe I'm here today with the mental capacity I got from that and the ability to, focus and learn. That is why I'm a chiropractor and why I graduated university. So I believe chiropractic has profound lasting effects on your life going forward, not just your back pain. Yeah. That was one case, but anyway.
And another thing I would like to add as well with the chain of having a neck issue can cause everything going down the chain. It also goes the opposite way. You might have sprained an ankle years and years ago, but that then is affecting your biomechanics, how you walk. You're putting more pressure on one side, and then you start feeling the back pain. If we're taking away the back pain, the issue in your ankle would still be there. So when you're walking, after the pain's gone, 4 years later, it'll come back because the ankle is still messed up and we didn't actually get rid of the function, or the actual dysfunction. As soon as we can focus on that, get rid of that, back pain stops coming back because the actual issue causing it isn't there anymore. So it works both ways, from your ankles all the way up to your head as well.
And that's also another case I had. I had a woman who's in her 80s. She came in, and while we have an extensive examination, so everybody should expect this when they go to a healthcare professional. And whether people say, well, they're under stress, they can't do it, I don't care. It's like what you should expect, right? I learned to have a full history taken from a health professional. I expect an examination to be been undertaken, and I expect a diagnosis or a conclusion of what they think or working rationale and a prognostic outcome. So prognostic means the future of what is going to take. Time frames, how long, etc. And so we give this to people when they come and see us. We allocate half an hour to take that full history, and we allocate half an hour to explain all the details of that on a separate occasion. One particular person, she was in her 80s, she had a low back pain. And she says, my back hurts. Now, you could go and adjust her back because she had some tension there, but as we went through the case history, we worked out that a few months before she had had a knee pain on the same side. And interestingly, a few months before that, she had actually sprained her ankle. Now, she had never had any proper rehab on her ankle, but her ankle didn't hurt now. So we get her to stand on her good ankle. It's a little bit off, she's 80, it's not the perfect balance. Stand on the other one, she's all over the place. We adjusted her ankle, a little bit of work on the soft tissue or maybe on her thigh, didn't touch her back. She had a 50% improvement in her low back pain without even touching her back. It wasn't her back that was the problem, it was the sprained ankle that nobody had rehabbed 6 months earlier. So yeah. Let's go to posture now. Now, Alex, you're going to shine in the light, mate. You're going to shine in the light. Round of applause for Alex. Well, you're just actually going to watch me first, but then I'm going to get we'll do some strength tests later. So the first thing is posture. We talked about the spine and the curves, okay? When we sit down in a chair, actually, I'll tell you what, Alex, sit on down in that chair. Sit how you normally sit in the chair. Is that how you sit? Yeah? Yeah, good. Relax. Now, what are you normally doing during the day? You're typing, or you with the kids? What do you do? What is your field? Tell me, like you're a teacher, right?
Yeah, geography teacher.
Okay. Is that standing? Is that sitting? What type of positions are you in?
I try and look around the classroom. Every now and then I might sit like this.
Okay. Now, Max, tell us why this is particularly bad. You got the spine?
Yep.
For those.
So, when you're doing this, what you're actually doing is twisting the bottom. This is the bad spine. Where's the other one?
Yeah, here we go.
So I can actually twist. So then what you're ultimately doing is you're sitting on the sitting bone, but then also twisting your spine. If you're sitting like this in long periods, look what's happening here. You're constant in this twisted position, puts a lot of pressure on these nerves, would start feeling some pain in your low back. At some point, you might not have it now, but it could potentially come on in the future. So that's why this is not that good.
Alex, can I just say, is this that you're getting, unless you're crossing the right ankle over that left knee, do you normally do the same side?
Yeah.
Interesting.
But that's because I had ACL reconstruction on my left knee.
Okay, that may be the reason. Stand up for me. So face that way, just have a little look. So I'm going to do a couple, you all right if I do a couple of tests?
Go for it.
Yeah, sure. So if you lean back over to your right, by the way, do you have any discomforts at the moment?
No.
Okay, fine. Okay. Lovely pun. Okay, lean back. How's that? Not too bad?
No, fine.
Good, excellent. Over the other side? Not too bad?
No.
Okay, good. Just going to press them through here. How's that, all right?
No, fine.
Good. How's that there?
Fine.
Yeah, not too bad?
Fine.
Good. Oh, you're an annoying case. Normally when people cross their leg, it is a giveaway because normally when they cross their leg, if you go and press on that side, they kind of jump. So look at your family members, and if they're crossing, say, for example, the right leg over the left knee, okay, and they repeat it and ask them, do they repeat it, do the same side? If you press on the sacroiliac joint, so this is kind of like what you're trying to do, it's like swaddling a baby, it's like wraps up nice and tight, so it pulls it tight, the tissues around there, but it kind of destabilizes that joint a little bit. You're doing it for a reason. Well, come on over here. Sorry, Alex, you take a seat there for a second. Come on up. So you've got the left leg over the right knee, yeah? So you're right if I just press on you a couple of times? Yeah, sure. So we come through here.
Oh.
Yeah. Oh. Well, that's not in the right side, yeah? Okay. How about in there?
Not as much depth. Oh no.
Yeah, so that one versus that one.
That one's worse.
Yeah, that was the one you was crossing over, wasn't it? And the tone of the tissue when I'm pressing in there, you can feel that, can't you? Now, do you particularly have any low back issues that you're aware of?
Sometimes, but not all the time. Shoulder,
Yeah. Oh, okay.
knee.
Okay. So we'll be booking in later, yeah. But see, this is the thing. So you don't really probably think too much about that, but you felt that if you felt like that all the time,
Yeah.
would you be thinking, oh, I probably do have a back issue?
Yeah.
Yeah? So this moves us on to the next thing. I'll let you take a seat. We're going to come back to you. Still stay there, Alex. So a little bit, we're going to kind of, let's get a colour in here. It's whiteboard, mate. It's fine. So we use this thing called a iceberg analogy. Now, the iceberg, in fact, it's not quite that big. Let's just do about here. We've got an iceberg, And we all know that about 10% of an iceberg is actually above the surface, and then 90% of the mass is actually below the surface, right? So what you see when you look at an iceberg is just like a little peak. So you see this iceberg, it's the size of a house. You can imagine underneath it's absolutely huge, right? And so with something like this, when we've got this little issue, we're focused on the bigger iceberg behind it, the shoulder, the knee, but the reality is we have something underneath that water that's actually growing, and what we actually see is the actual symptom. Which means if the symptom goes down to 0 and we can't feel it, what do we think? There's no problem there. But as soon as I press that on that one side, more so than the other, oh, so what a chiropractor's effectively doing is we're pushing it up so you can actually see there is an element of an iceberg. If I pressed on you and you don't feel too much like on you, if I press on you, I'm like, maybe it's not too bad actually with you. But generally, as a rule of thumb, when you see that, you do know that there's probably got a sacroiliac joint problem, which will then lead into a knee problem, and it also can lead into a shoulder because it ripples through the kinetic chain, right? So posture-wise, so now this is really good. Because you see, while I've been talking, he's actually relaxed into some kind of posture that's interesting. So now what did you notice about your posture like now compared to before when I said to sit down?
I was probably more rigid when I sat down originally.
Yeah.
And now I've slumped a little bit. And
Is it more comfortable? I mean, honestly.
yeah.
Yeah. And that's why we slump down to the chair. Now, if you stand up for a second, I'm just going to show you. So what happens when you slump down into a chair? So we get these nice curves, right? So if you just come forward a little bit. So here we are in the chair, right? So you can see that one as well. So we're sitting in the chair like that. But as we slump down, yeah, what happens to that curve? Yeah, you lose the curve. And remember, that's like walking off straight, jarring action, and that can ripple through the entire spine, starting off with a little knee where we don't even notice, and then ending up in pain years later. So our job is to get in, not only adjust these joints, but mainly also give you the tools that you can take away and manage your own health care. See, one of the key things in the General Chiropractic Council, the GCC, who regulates chiropractic, so we are a regulated body, is that patients are not dependent on care. And you'll hear people out there, I've just heard someone the other day say, oh, but you have to keep going back. You don't have to come back to me ever. You can only come back to me in pain if you want. But in my world, that's a bit like if you went to the dentist and you only went there when you had pain in your jaw. Do people go to the dentist only when they have pain in the jaw, or do people go there a bit more regularly? And do you have pain when you go to the dentist? Always? No. So why do you go to the dentist? Yeah, and your spine is no different. Why do you eat good food? You eat good food, maybe you want to lose weight, you go to the gym regularly. What happens when you stop doing that? I love it when people go out and they say, oh, I'm going to go to the gym, and then like, oh, yep, no, I've got the weight down, that's fine, I don't need to go back now, I'm all sorted. And then they wonder why it comes back. 90% of people on diets, they fail because they go off them and they just go back to the normal lifestyle. You have to maintain it. But here's the key. The key is maintaining a level that's right for you. And there is a level of chiropractic for everybody in the entire world. I have chiropractic care, not because I'm in pain, because I don't want to have pain, I want to function the best I can. Max had chiropractic, I just adjusted them the other day. Ying has chiropractic care. Everybody in my team has care. Not because they're in pain and they need it crunched and clicked. And sometimes when people come and see me, most people see me once a month. Some people see me more often. Some people see me less. They come and they get checked, and they're coming in and I'm saying, how are you moving and functioning? I'm like, I'm great. I'm top. Excellent. Let's check. Oh, little restriction there. Oh, you're actually not too bad today. Maybe you can space out a little bit longer. Maybe we'll keep you there. Yeah? So there's a level for everybody. Coming back to postures again. So the best way to sit, we all do it at the start, upright. Simple. Put your bottom back into the back of the chair, wiggle back. You'll feel about 2 inches taller. And then you'll probably slump down as you continue to listen to us. But then you'll do it again. But it's being aware of these positions. That's the thing. It's awareness that I want you guys to take away. When you're sitting there in the classrooms, awareness. When you see the kids, see it all the time. And and you've got to inspire it. And the best way I've found, and obviously it's a bit different, you can't see this as a teacher, but I can do it in the clinic, is I'll grab their phone with the parents' consent, and then obviously I'll take a picture of them while they're like that, and I'll say, okay, I'll get you to pull your shoulders back. So I want you all to squeeze your shoulders back gently, like holding a little orange between your shoulders, just very gently. And I'll get them to hold that. That will help hold you upright. You'll naturally tuck your chin in a little bit. Yeah, you're going to be booking in later too. So, and you'll hold this position like that, and then I'll take another picture. And then you show the child, and you show them the good one first. You say, oh, look at that. That looks really, what do you think? You think that looks good? And then I say, but that's you. Oh, penny drops. They never listen to their parents about it, but they'll listen to somebody completely random about it. Say, oh yeah, I better do that. And they might start down PlayStations, texting, all this thing. There's a condition called text neck. Anyone heard of that? Yeah. And there's ways around this. So with children studying, very simple. They say, well, the cost and stuff. I said, look, get a few books, stack up your book, lean it on top of them. You've got a free razor, and then you can lean whatever, look at the book and study. Brilliant. And it just stops you having to do this. Using the phone, lock the elbows in, or on the, now I know in the old school, we're not allowed to have elbows on the desk, stuff like that. But unfortunately with this here, it is better than them doing that. So yeah, there are little ways around it. So we talked about sitting. Now let's go to standing. So I'm going to get everyone to stand up. Okay, so when we stand, you're not standing too bad. That's good. I'm glad, Alex, I'm glad. If we tend to cross that leg over, a lot of people tend to actually stand on that leg as well. So watch out for that. So if you might know, I'm not crossing, but I am standing on this one leg. That's usually the same problematic side. So if I press in on that side, you'll jump again. And basically what we want to do is we want to stand evenly. If you stand on one leg, on one side, these muscles are going to get tight, and these muscles are going to be less so, and there's going to be more loading on these joints, which ultimately is going to give you a problem to your low back. So I'll let you all take a seat again. Sitting down the correct way, remember, bottoms back into the chair. Yeah? Now, we've got about a few more minutes left, so the last one I was going to say would be laying. How about posture? Sorry, I'll let you take a seat on this one. Very good. Round of applause. Very good. So one of the things we do is we actually have a health class in our clinic. Anyone's more than welcome to send somebody in, and if you mention that you've come from here, we won't charge you. We normally charge £10, but we won't charge anybody from here that refers somebody in. We also do complimentary checks, so it's a 10-minute assessment. There's no charge on it. If we do a new patient, that exam that I talked to you about, there is a charge. It works out at £79 for the 2 appointments. But for an hour of a chiropractor's time, £79 I think is fair. Looking at here, if we lay down on our side, the mattress is too soft, we get this. Mattress is too firm, we get the opposite. So what we lay on is important. And I say a mattress with a lot of pocket springs, it's going to really support you. If you've got temper, who knows about the old temper mattresses? Some people don't like them because they sink into them and they feel very hot. But as long as you're not doing that, that's the key. And pillows, exactly the same. How many pillows? Small one, 3 small ones. The key is the difference from here to the side of your head, right? So there is no magic number on pillows. And yes, you can pay 50, 100 quid for fancy pillows. It doesn't matter. It's about supporting here. You can pay £1,000 for a fancy chair. They're nice. They will possibly be better than your good old wooden chair. But the reality is, it doesn't matter. You can take a chair, any chair, put a cushion behind it, and you can make it better than some of the fancy £1,000 chairs, right? So when people say, oh, I don't have the chair, it doesn't matter. That's pretty much it. I mean, the one thing I was going to say as well, pass that around, have a little click on that. We see children, I see children. That's my area of special interest, paediatric chiropractic. There's not many chiropractors in Essex that do, there's probably a handful of us. And people will say, why do you see a baby? They've got a nerve system. Why wouldn't I? Traumatic birth, pulled out. colic kind of complaints. Now, I'm not treating their colic, very important, but what I find is they have usually a lot of restrictions around the thoracic area, lower thoracic lumbar, and those nerves feed into the gut area. And I find that when you unlock those restrictions, all of a sudden, within 1, 2, 3 sessions. In fact, if you look on our YouTube, we've got a YouTube video channel, there's a review of one mum. I think she had 2 sessions, 85% improvement with her child. I have one that I've got to upload, got to get around to it. She had 95% improvement after 1 session. She's a nurse, and her baby was on 5 medications and now is on none. That's pretty cool. Who here knows somebody's got a baby? Yeah? Are they seeing a chiropractor? If you could have that much potential and on the learning in their future, why wouldn't you give them an opportunity? So again, complimentary check, it applies to babies as well. And all we ask is you tell people about it. Yeah? And if it's something you genuinely are interested in, you say, actually, I really want to follow up and get something done with myself, then you've got the new patient option. But that's us. Yeah. And if you'd like to find out more, feel free to come speak to you. If you'd like to take advantage of even the free check, speak to you. She'll get you booked in. We've got 2 clinics, one in Brentwood, one in Billericay. We've got Max here who's taking care of pretty much most people. I like to take the more difficult cases. I'm kind of stepping back. I'm getting too old. No, but we've got Max, we've got Dan, and we have 5 other massage therapists that work with us as well. So we've got a very good team, and we just installed a coffee machine that grinds the beans, and we offer it for free to all our patients. And I love that. I love giving more back. So yeah. But yeah, unless anyone's got any questions, feel free to speak to me, and then otherwise...